Let's take a look at an example using the CHARTific veterinary dental charting system of an actual case with periodontal disease. We'll look at the gross image here. You can see that the fourth premolar rostral to the second premolar, along the margin of the gingiva, there's severe inflammation present. You've got a lot of gingival swelling adjacent to this second premolar on the distal root. We're void of any attachment here with gingival recession, about 3 or 4 millimeters. And then we've got a mass-like effect over the crown of this third premolar, and then finally we have a ulceration above that distal root of that second premolar. This could be described as a Cupp's lesion or chronic ulcerative periodontal stomatitis, where the mucosa adjacent to the recession here, when the lip is down in normal position, is causing this ulceration. Radiographically, we can see the distal root of the fourth premolar has almost no bone present. We're sparing, surprisingly, the first molar and the third premolar adjacent to these defects, and also the mesial roots look pretty much unaffected radiographically as well. Moving rostral, we can see that the second premolar has almost complete bone loss adjacent to both these roots and significant pathology associated within the furcation and the distal root, where this tooth would likely be mobile. Now let's see how we might chart this case. We know we had some pretty significant gingivitis adjacent to the maxillary right fourth premolar, third premolar, and second premolar. So what we can do, first of all, I would enlarge this a little bit using 2 fingers on the screen. You can see we've got a diagnosis portion of the cartoon on the chart and a treatment portion of the cartoon. I'm going to concentrate obviously on the diagnosis portion right now. And what we can do is go to the annotation here down with the image stamp down here as part of the annotations, tap that, and that will bring up all of our abbreviations. So what we want to do is go to gingivitis index 3. We had some pretty significant gingivitis, so we tap that. We tap where we want it on the chart. We go back to image stamp. We tap gingivitis index 3 again. We tap it where we want it on the chart. Go back to image stamp, tap that again, and there we go. We've got them all lined up the way we want them. We can also move them as we need to. And there you have it. So the other thing that we noticed was that we had some periodontal disease associated with the distal root on the fourth and the second premolar. So again, go back to image stamp where the majority of our notations are going to originate from. Go to periodontal disease index, and you can see here we've got 1, 2, 3, and 4 PDI 1, 2, 3, and 4. That's stage 1, 2, 3, and 4 periodontal disease. So we hit PDI 4, and we can tap that there. We go back to image stamp, tap that again, and there we go. And we've left a little room there because what we're going to do now is we're going to put some arrows pointing to the area where the lesions are adjacent to the distal root on the second and fourth premolar. So go to the little symbols underneath the T in the upper portion of the annotations. Click that, and you'll see we can use a square. You can add different colors, whatever color you choose for that. Then there's a circle, a line, and an arrow. So we'll use the arrow, and we'll keep that green. So we've tapped that little arrow, and then I'm going to tap next to where we want the arrow to originate. So we'll tap next to PDI 4, and we'll point it right to that distal root there. Tap the arrow again, go to the other PDI 4, and have that point right to that little area. Now if we have our image or our arrow a little bit too long, you can see there's a little blue dot in the front and the back of that arrow. You can just move that a little bit, touch that and move it, and then you'll see disable snapping. Snapping is where it will snap to a grid. We want to disable that if we want to just move it freely wherever we want to move it, so we can do it like that. Move it like this, and there you have it. So we also had a little mass, adjacent to the third premolar, so we can draw that in if you like. So go back up to the little pencil marker, and you can change the font size of your symbol this way. So we'll go down to about a 2 point, and then we'll enlarge that a little bit, and we'll create a little mass here. Actually, that's the line. We don't want that. Let's go back to the upper check. Go back to the two little pencils here on the upper side, and that'll allow us to make a little line. So again, we go back, let's make that 2 point, and we'll just create a little mass there. There you go. So now go back to the upper check box, the little green check symbol there. We'll check that. And then we had that cups lesion that was present. And so we can go to the second screen where we have the arcade visible, and we can place that little cups lesion by doing the exact same thing. So we'll go up here, hit that, and then go up here and make that little lesion, and then hit your checkbox again at the upper left in the green. Go back to image stamp, and there's a cups image stamp here, so we'll just go to that, hit that, and there you go. Resize that, you put that right there, you can put it above it, whatever you want to do. Then we have that gingival recession as well, so we can do a little notation there. We can show where the gingival recession was, which was right underneath that cups lesion. Let's enlarge that a little bit more and just put that as a lesion. Then back to the green checkbox, go back to image stamp, and then to GR. So we'll say it's about a 4 millimeter recession. Let's hit that, and we're good to go. Let's go back to the first page. That was also, we could also put oral mass adjacent to that. So go to your image stamps again, go to oral mass, O. Oral mass, boom. Resize it. Go right there. So there you go. Now, moving over to the treatment side, the first thing we're going to do is a nerve block. So we'll do a caudal maxillary nerve block, and in order to fit it nicely and leave room for the other annotations, we choose that particular angulation so that we can put it right there. And make it, again, make it smaller or larger, however you like. And then we're going to create a flap over that fourth premolar. So again, go to the image stamp, go to flap, hit F, there you go, put that right there. And then we've got a couple of options for extraction. Go back to image stamp, you can go to standard image stamp, scroll down and use the red X, or you can go to custom image stamp, and one of the first ones, because it's so common, is right here under the nerve block symbol. Hit X, and then we can use that as well. So either one, either the red X or the black X can be used there. And then we're going to biopsy that little oral mass. So we can go and we can say biopsy, we can say biopsy excisional, which means we're attempting to excise the whole mass, or we can go to biopsy incisional, So we can do either biopsy excisional, biopsy incisional. We're going to try to excise the whole thing, so we'll put biopsy excisional there. And there you have it. If you'd like, you can do the other annotations again on this portion of the chart. Obviously, the two first pages of this chart together are equal to having all of that information on one chart. So all of this is going to be sent to the client. If you're a specialist, all this is going to be sent to the referring vet. So all the information is on these two pages mainly, and consequently you don't need to do everything on both charts if you don't want to. So there you go.